up on Family Health today, the very latest on the H1N1 virus vaccine. Later, a look at why parts of Kansas are having trouble finding doctors. And how your purse could be taking a toll on your health. Family Health Today is next.
Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues that affect you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Heart and Vascular Center and the Arkansas Democrat Gazette.
Hello, welcome to Family Health Today. I'm Dr. Janette Nesheiwat. Congress is going to miss the president's deadline to have health care reform bill ready by August. But the so-called blue dog Democrats in the House, like Arkansas Congressman Mike Ross, worked out a deal with their Democratic brethren after threatening to derail the whole process. Dana Bash is in Washington with the details.
If the president had any lingering hopes for a summer vote on health care, forget about it. Under the new deal with some conservative Democrats, the House would follow the Senate's lead and delay a vote until the fall.
We believe every member of Congress should have the opportunity to not only read the bill, but to spend the month of August visiting with their constituents about it.
Conservative House Democrats concerned about cost say they trimmed the overall price tag of the health care bill to just under $1 trillion. And to try to protect small businesses, they convinced House Democratic leaders to exempt companies with payrolls below $500,000 from a mandate to provide or help pay for health coverage. But perhaps the most important to the president, this House deal keeps an option for consumers to get health care insurance through the federal government. Conservative Democrats successfully made changes to the way a public plan would be structured, but that government-run insurance option, one of the president's top priorities, remains intact in the House Democrats' plan.
A federal advisory committee has issued sweeping guidelines for vaccinating against the swine flu or H1N1 virus. The guidelines approved last week at the CDC in Atlanta cover more than half the population. The priority groups include pregnant women, healthcare workers, children, everyone from 6 months to 24 years of age, those who live with young children, younger than 6 months, and healthy adults with certain medical conditions. The panel only gives recommendations, but the federal government generally follows its decisions. Federal officials say they were on a track to start a mass vaccination campaign in October. Clinical trials on vaccine safety and effectiveness are just beginning around the country. As dangerous as cigarettes, arsenic, and even asbestos, that's what a new study says about tanning beds. The United Nations Cancer Research Division is now making its strongest link ever between tanning beds and the different forms of skin cancer, like melanoma, which kills more than 8,500 people in the United States each year. Brian Todd reports.
They look enticing for those who want a tan without extended sun exposure. CNN intern Genevieve LeMay is one of the millions who routinely use tanning beds.
When I go tanning, I feel good about myself. I have confidence, I look healthy, I feel great.
But now the UN's cancer research arm is ranking tanning beds in its top group of cancer-causing substances, right up there with cigarettes and arsenic. An official with the International Agency for Research on Cancer tells CNN people who consistently use tanning beds before the age of 30 increase their risk of getting skin cancer by 75%.
Now, to illustrate the real effect of tanning beds on the skin, we came to this place called Radiance Med Spa in Washington, D.C. It does medical and aesthetic skin treatments. It's got this digital skin analysis device, almost like an X-ray machine. We're going to test it out with our intern Genevieve, who does use tanning beds, versus the skin of our intern Catherine Castellanos, who does not use tanning beds.
They each go through the scan. Some very detailed images pinpointing skin damage tell the story. We look at the results with Dr. Howard Brooks, a dermatologist not affiliated with this spa, who the facility allowed to come in as an independent analyst. First, Catherine's results.
The fact that she doesn't use the tan beds shows here on this picture. Much less brown spots, much less UV damage.
This brown image of Genevieve kind of does reveal the real damage.
This is a perfect illustration. Genevieve is a 20-year-old young woman. She admits to using tanning beds, and this is the result of tanning bed use, as the study indicates. You see all these brown spots here, which indicates UV damage that is directly related to tanning bed use.
Does it change your perspective at all?
The results were shocking. I mean, I looked horrible, but as much as that's a deterrence, tanning is addicting, and I don't know if I'll stop going right away.
The Indoor Tanning Association, an advocacy group for tanning spas, says media reports linking tanning beds to things like cigarettes and arsenic are overhyped. The association has taken out a newspaper ad this week saying indoor tanning put in the same category as sunshine? Duh. The association says it's always emphasized moderation.
An alternative may be the use of spray tans, which involve no UV exposure of sunlight. Well, a shortage of doctors in rural Kansas means many residents are having a hard time getting medical care. In much of western Kansas, where farm fields way outnumber people, hospitals are small and doctors are hard to find. A joint effort is now underway to attract more physicians in rural areas. Stephanie Bergman reports.
In much of western Kansas, where farm fields often outnumber people, hospitals are small and doctors scarce. Just 2 physicians here in Kinsley, 1 in Dighton at the state's smallest hospital with only 10 beds, but more importantly, an emergency room.
I just took the wrong medicine at the wrong time.
Internal bleeding made 84-year-old Earl Gorman realize having a doctor close by can be a matter of life and death.
If there would have been an ER here, he would have had a 35 to 40-minute drive elsewhere, and in his fragile situation and fragile state, that could have been disastrous.
But Scott City is lucky, by comparison, to have 3 doctors at a hospital that still delivers babies. Most small hospitals do not.
Yeah, he's just looking a lot better.
Dr. Daniel Dunn delivered this little boy and his mother and her siblings years ago. But after 3 decades in practice, retirement is still not an option.
It would be a hardship for the hospital here if I retired now, yeah.
Scott County Hospital has been trying to hire another doctor for the last 2.5 years, but they found what makes small-town medicine so exciting to one doctor is exactly what scares many others away.
A trauma comes into the ER, I have to be able to handle that. At the same time, I may have a woman in labor. At the same time, I may have somebody on telemetry not doing well.
There's some comfort in practicing in a big city. You've got a specialist right around the corner.
But here, the cardiologist, for example, comes once a month to see patients. Any heart emergencies still fall to the family doctor.
You are the first line of defense in keeping somebody alive.
Hospital President Mark Burnett believes recruiting more doctors to small towns depends on more medical students training here.
Show them the lifestyle, show them the practice, let them see what it's all about.
That's exactly what the new dean of the KU School of Medicine in Wichita is planning.
Hi ladies, how are you?
Good.
I'm David.
As a pediatrician with Midwestern roots, David Wilson knows the importance of getting medical students out of the urban hospital and into the trenches of rural health care.
I think exposure helps a lot when they see that the local doctor is a very important person in that community and that the local hospitals have a lot to offer.
But there's also the issue of fewer medical students going into family medicine. With numbers now at a 15-year low, the Kansas Academy of Family Physicians is predicting a perfect storm. More elderly needing care, aging doctors retiring, and fewer new ones to replace them.
We're actually, I think, past the crisis stage, and we're now with our toes over the precipice, looking down into the abyss.
The only hope, he says, is to even out the pay scale. While family physicians earn about $170,000 a year, specialists can make twice that. Much of what determines a doctor's pay is how they're reimbursed by Medicare, a system that favors specialists.
If you don't perform a procedure, if you don't have a test or send somebody to the laboratory, there's no money that comes from Medicare or Medicaid.
The congressman is now pushing for reform and more government scholarships for medical students who agree to work in rural Kansas, hoping once there, they'll see that small-town values are contagious.
I think the rewards are more out here because you get to know your patients, and there's just something to that you can't put a number on.
Another shortage in the medical field across the nation, African American doctors. Less than 1 in 20 U.S. physicians and surgeons are African American. Dr. Sanjay Gupta looks into what's causing this lack of diversity in today's Health Minute.
Well, I'm Dr. Estes.
Dr. Zaviera Estes is one of America's young black doctors, and it's her first day on the job at Memorial Hospital in Savannah. Her patient is expecting a baby. When she was in the second grade, Estes decided she wanted to be a doctor. But growing up in predominantly black inner-city Houston, she was dreaming big.
You can never be a doctor. Why won't you settle for being a nurse or a medical assistant? No doctor has ever come out of this community.
Less than 5% of U.S. physicians and surgeons are black, a real shortage. Dr. John Maupin, president of Morehouse School of Medicine, says it's important to close the diversity gap.
It's going to take a long time to have the kind of diversity that this country needs so that students can believe that that's what they can be. Biggest barrier right now is the graduation rate of African American males and African Americans from high school. We're having too many people drop out.
Okay, thank you so much.
Here at Memorial Hospital, Dr. Estes has an opportunity to work with minority patients. And today, she helped deliver little Allison.
They always say you'll never forget the first baby you delivered.
For today's Health Minute, I'm Dr. Sanjay Gupta.
We've been talking a lot about the powerful drug propofol, or Diprivan, that Michael Jackson's doctor allegedly gave him before he died. Many doctors say it's dangerous to administer outside of a hospital setting. Dr. Sanjay Gupta is back to take us inside his OR for a unique look at someone actually going under the powerful anesthetic.
There's been a lot of discussion regarding propofol, how exactly to use it, and is it considered safe in any setting except a hospital or a medical setting. So I decided pictures are worth 1,000 words. I'm going to take you inside my operating room to show you firsthand what really happens. Come on in. So we are here inside the operating room with Dr. Gershon, who's the chief of anesthesiology here. Propofol is a medication he uses all the time. So is this it right over here?
Yeah.
It looks like milk of amnesia, they call it.
Milk of amnesia. Vincent, you okay? We have to monitor his EKG, we have to monitor his end-tidal CO2, we have to make sure that he's breathing, we have to see his saturation, we have to make sure he's ventilating.
So these are all, that's all typical stuff anytime you use these
standard of care, yes.
Okay, so the propofol.
We're going to start infusing this. You're going to get a little sleepy, Vincent, okay? Give me some good deep breaths.
So watch us go and take a look at his eyes, how quickly this...
Deep breath, Vincent. Doing great. You may feel a little burning, okay?
10,
Deep
9,
breath.
8, 7, 6, 5, 4, 3, 2, 1.
There's a reason for his heart rate increasing.
I have to switch hands.
So what you see, his eyes is closed.
So his eyes closed, and what else are you looking for?
I would look up here. He stopped breathing. So this is watching his end-tidal CO2, and he's not breathing anymore, and my wonderful anesthetist is going to help him breathe. Okay.
So take a look over here. That all the breathing right now is taking place with this bag and this mask. From that medication, he wouldn't be able to breathe on his own without those things. Well, there you can see part of the problem. Just with that much propofol there, he stopped breathing, and he's going to need a breathing tube.
Easy?
Easy.
What's so attractive about this medication?
Well, it's really been in the advent in the last 10 years or so, even more, 15 years, and it's just basically a quick on, quick off. And that may answer why people may think that this is something they could do at home, because if it gets out of hand, it goes away quickly. But the problem is it gets out of hand and there's nobody there to resuscitate you, then nobody could bring you back.
So that was pretty quick. You just gave some of the medication. You're going to
5-10 minutes.
5-10 minutes. He's gone from being completely awake to completely asleep.
He's not breathing. I'm breathing for him.
One thing that's worth pointing out is that this is a hospital that uses this medication thousands and thousands of times a year, but they do use this medication in non-hospital settings like outpatient clinics. The doctors here will tell you they've never heard of it being used in a home.
Never. In case you're wondering, the patient you saw going under during the piece is doing just fine. He's awake and had no complications. Well, up next on Family Health Today, good news in the fight against psoriasis. After the break, we'll explain here on Jones Television, Channel 22.
Getting fit, eating right, and staying up on the latest health news. They're good habits that can help you look and feel your best. You can get the details on the top health and medical stories every week in the Arkansas Democrat Gazette, the state's largest newspaper. take a more hands-on approach to good health and pick up some good habits, like the Arkansas Democrat-Gazette.
Welcome back. I'm Dr. Janette Nesheiwat. Recently, the U.S. House of Representatives appropriated $1.5 million to establish the first psoriasis patient registry at the Centers for Disease Control and Prevention. The government patient registry will collect and track data for the first time on people with psoriasis and psoriatic arthritis. Information from this registry will help fill the void in understanding how psoriatic disease behaves, why it affects people differently, and how it's associated with a number of serious health conditions. The registry will also allow scientists to drill down and explore how certain factors such as age, gender, genetics, environment, and race affect psoriatic disease. Well, for a closer look at this medical condition, we are joined by Dr. Eric Stewart, a dermatologist with Ozark Dermatology. Dr. Stewart, thank you for being here with us.
No problem at all.
So tell us, what is psoriasis? Define that for us.
Psoriasis is basically an autoimmune disorder manifesting as a couple of different things, including typical things that patients might assume are present, including red, scaly plaques on the skin, as well as sometimes involvement of the joints and the nails as well. But the underlying cause of this is a combination of genetic susceptibility and, as with many diseases, an environmental trigger.
So it can be hereditary as well as autoimmune?
Certainly, and you can see this as it runs in families in some cases, and can be associated with other autoimmune disorders in family members, such as rheumatoid arthritis, for instance.
What are some of the first symptoms that you see in patients who have psoriasis?
It can vary, but it's usually redness of the skin. It can affect any body surface area, but the common places that we see it would be the elbows, the knees, scalp, hands and feet in some patients. But usually redness, scaling, thickening of the skin in some cases, and itching as well.
So are there different types of psoriasis, Dr. Stewart?
There are. The most common type would be what we refer to as plaque-type psoriasis. There are other forms as well. Some patients have it limited only to the hands and feet. Other patients have what is known as pustular psoriasis, which does not often have the same kinds of scaly areas, but often will have pustules with it. We talked about a little bit before, but there's involvement of the nails in some patients. Other patients have it only limited to the scalp.
I see. How do you diagnose psoriasis?
A seasoned dermatologist is usually going to be able to diagnose this just by looking at the skin. Occasionally a biopsy is needed if the presentation is unusual or if the clinician is confused about the presentation. And in that case, a small piece of skin can be taken and analyzed under the microscope, and then the diagnosis can be rendered.
I see. Is it possible to prevent psoriasis?
No, I would not consider it to be preventable, given the genetic factors that underlie the cause. It doesn't seem to me to be a disorder that can be prevented.
I see. Now, tell us about the various treatments for psoriasis.
This is a field that's expanding rapidly. There are a lot of different treatments. I break them down into three basic types of treatments. The first type for simple cases is topical treatments, where usually a cortisone derivative or something similar is applied to the plaques on the skin. Light therapy is also helpful, and many dermatologists will employ a medical light box, which has some similarities to a tanning bed, but emits a slightly safer wavelength of light that can be used for some patients. And then the most severe patients are those with psoriasis involving the joints, are oftentimes needing more potent medications, and will sometimes use internal treatments delivered either by pill or by injection to treat their psoriasis internally.
I see. What can make psoriasis worse? For example, does what you eat, can that affect psoriasis? If you have a lot of stress in your life or if you're inactive, does that play a role role in psoriasis?
Certainly stress, as many psoriatic patients will tell you, is a big flare for many of them. But there are other things as well. Infection, if a patient gets a bad infection, be it influenza or a strep throat, these are classic triggers for psoriasis and can bring it out in someone who's never had psoriasis before if they're susceptible. Injury to the skin is a well-known a culprit. If you have a scratch or a cut or a sunburn, these things can bring psoriasis out. There are certain medicines that can either cause it to occur in a predisposed person or worsen it. So there are several things.
Have you found that sometimes you have to not only treat psoriasis with the medicines that you mentioned earlier, those treatments, but do you put them on antibiotics as well if you think there's an underlying infection?
You know, it's a great question, and it's been interesting that we've seen patients that are maybe they're hospitalized for an infection and they're given no treatment for psoriasis other than antibiotics for their infection, and their psoriasis will clear. It's very interesting how that works sometimes. Routinely, no, we don't give them antibiotics, but you know, it can be something that adjunctively, for other reasons, psoriasis may benefit as well.
I see. What's the difference between psoriasis and eczema? Do they look similar, and are they treated similarly or differently?
In certain cases, they can look very similar. Eczema involving the hands and feet and psoriasis on the hands and feet can be very difficult to distinguish. In fact, some dermatologists even have terms of overlap for these disorders. They are due to different reasons, different causes, underlying causes. Both have the real reason behind the rash is an immune system imbalance. But really, that's where the similarities end, and certainly eczema falls more into the category almost like an allergic hypersensitivity of the skin, whereas psoriasis is more of a misdirection of how the immune system behaves in response to some sort of environmental trigger.
Such as like a virus or viral infection?
Exactly.
What other type of diseases would you see in a patient who has psoriasis? Anything that's common?
Well, again, rheumatoid arthritis, other disorders of the immune system occur occasionally. But many times it's a standalone disease, and for most of our patients with psoriasis, they don't necessarily have anything else, just psoriasis.
All right. Any final thoughts, Dr. Stewart?
Well, one thing that has come up and it's become in vogue to discuss at some of our meetings, and something you alluded to earlier, that there's increasing amount of data that patients with psoriasis may actually be at risk for more severe illnesses, particularly cardiovascular disease, and that probably owes to the fact that patients with psoriasis have chronic inflammation in the body. And we're finding that patients with problems such as psoriasis, rheumatoid arthritis, other diseases of chronic inflammation can certainly lead to worsening cardiovascular health and some other problems as well. So the most severe patients with psoriasis would benefit from getting it under control in other ways just besides how their skin looks.
All right. Great information. Well, as usual, it's great to see you again, Dr. Stewart. Thanks for being here.
Not a problem at all. Thank you.
Coming up on Family Health Today, if you're a woman who loves purses, have you ever wondered what the accessory is doing to your muscles? We'll take a look up next on Family Health Today.
Award-winning Jones Television, Northwest Arkansas's 24-hour nonprofit cablecast, is now on the internet. JonesTV.org features a first-hand look at what the station is doing for the organizations and people of your community. The site gives you access to the daily TV schedule, as well as various clips of shows hosted by local experts. And our community calendar gives local organizations the opportunity to promote upcoming events in Northwest Arkansas. Jones Television, Channel 22, bringing you timely community programming, public service announcements that benefit our nonprofit partners, and now an easier way to learn more about us. www.jonestv.org.
Welcome back. If you've ever had shingles, you know it can be a painful experience. We get more on this medical condition from the pharmacy.
Shingles is a viral infection that causes a painful rash. It often appears as a band of blisters that wraps from the middle of your back around one side of your chest to your breastbone. Other parts of your body can be involved as well, including your neck, face, or scalp. The pain of shingles can be excruciating, and the cause might not be immediately evident. Early treatment can help shorten a shingles infection and minimize the chance of complications. An episode of shingles usually heals on its own within a few weeks, but prompt treatment can ease the pain, speed the healing, and reduce your risk of complications. Your doctor may take a 3-pronged approach to your treatment. He may prescribe a high dose of an antiviral drug to reduce the duration and severity of your symptoms, an anti-inflammatory drug to ease the inflammation, and pain relievers to control the pain. From the pharmacy, I'm Carl Collier.
A trendy, supersized purse can be painful for your wallet, as well as your back. Judy Fortin has more in today's Health Minute.
A heavy handbag may look good slung over your shoulder, but have you ever considered what all that excess weight is doing to your muscles?
It's not uncommon for some of these bags to approach 15 or 20 pounds.
Doctors say lugging around an oversized purse can throw your spine out of alignment.
You can get a chronic spasm that goes from the trapezius up into the neck, and that can result not only in neck and shoulder pain, but also headaches. Some of these things, although not permanent, can become chronic. If you develop muscle spasm in, let's say, the muscles of the neck, sometimes these things can take months to resolve.
It's not just women who are feeling the pain. Men are prone to something called wallet sciatica, affecting the lower back and spine.
Imagine sitting on a 3-inch rock, or which really you could compare your wallet to.
Experts suggest taking a load off, literally, and emptying out your purse or wallet at least once a week. If that doesn't relieve the excess strain, try carrying a backpack to more evenly distribute the load. For today's Health Minute, I'm Judy Fortin.
Thanks for being with us for Arkansas's only weekly medical report. If you have any health news or story ideas that you'd like to see on our program, well, we'd like to hear from you. Visit our website, jonestv.org, and drop us a line. Join us next time here on Jones Television, Channel 22. I'm Dr. Janette Nesheiwat.